Welcome, students, to today's histology lecture. In today's session, we will dive into the fascinating world of tissue histology. Throughout this lecture, we will explore various types of tissues in the human body, examining their structures and functions in detail. So, let us begin our journey into the microscopic world of histology. Hyaline cartilage, also known as articular cartilage, is a connective tissue that provides structural support and reduces friction in joints. It consists of chondrocytes embedded in a collagen and proteoglycan matrix, giving it a smooth appearance. Although resilient, it has limited self-repair capacity, leading to conditions like osteoarthritis. Elastic cartilage is a specialized type of cartilage found in structures like the outer ear and the epiglottis. It contains abundant elastic fibers, chondrocytes, collagen fibers, and proteoglycans. These properties allow it to maintain shape and structure in areas subjected to movement. Fibrocartilage, as the name suggests, is a type of cartilage that possesses characteristics of both dense regular connective tissue and hyaline cartilage. It consists of chondrocytes scattered among dense collagen fibers. This type of cartilage is commonly found in areas subjected to high mechanical stress, such as the intervertebral discs, pubic symphysis, and certain tendons and ligaments. Fibrocartilage serves as a shock absorber, providing strength and stability to these structures. Due to its unique composition, fibrocartilage exhibits properties that allow it to resist compression and provide tensile strength. It serves as a transitional tissue between hyaline cartilage and dense regular connective tissue, combining the advantages of both. Bone remodeling is a continuous process in which old bone tissue is resorbed and replaced by newly formed bone tissue. It is a highly regulated process that maintains bone integrity, repairs micro damage, and enables bone growth and adaptation to mechanical stress. Osteoblasts, responsible for bone formation, and osteoclasts, responsible for bone resorption, work in coordination during bone remodeling. Hormones, growth factors, and mechanical forces play essential roles in regulating this process. Bone remodeling occurs throughout life, allowing bones to adapt to changing demands. It helps repair fractures, maintain bone density, and shape bone structures. Imbalances in bone remodeling can lead to conditions such as osteoporosis or excess bone growth. Osteoporosis is a condition where bones become weak and prone to fractures. It affects mainly older women due to hormonal changes, but can also affect men and younger individuals. Factors like age, hormones, nutrition, lifestyle, and medications contribute to bone loss. Treatment includes lifestyle changes, vitamin intake, exercise, and medications. The bone marrow is a soft tissue found inside certain bones that produces blood cells. It consists of red marrow, which is responsible for blood cell production, and yellow marrow, which stores fat. The type and composition of bone marrow change as we age, but can also adapt to increased blood cell needs. Lymphoid tissues are essential for immune defenses against pathogens. They are found throughout the body, consisting of structures like lymph nodes, tonsils, and spleen. These tissues contain specialized immune cells arranged in specific patterns, enabling effective immune responses against antigens. Lymph nodes filter lymphatic fluid, tonsils guard against inhaled or ingested pathogens, and the spleen filters blood and removes old red blood cells. In the thymus, T lymphocytes develop and mature, crucial for immune defense. Its structure consists of lobules with cortex, immature T cells, and medulla, mature T cells and specialized epithelial cells. Thymus size decreases and activity lessens with age. Adipose tissue, commonly known as fat, is an essential connective tissue that serves multiple functions in the body. It is composed of adipocytes, which store energy in the form of triglycerides, and a supporting stromal vascular network. Adipose tissue is categorized into two main types: white adipose tissue, WAT, and brown adipose tissue, BAT. What is predominantly involved in energy storage, insulation, and cushioning, while BAT is specialized in heat production. Excessive accumulation of adipose tissue, particularly WAT, can lead to obesity, a chronic condition associated with numerous health risks, including cardiovascular disease, diabetes, and certain types of cancer. Understanding the cellular and molecular mechanisms involved in adipose tissue metabolism is crucial for developing strategies to combat obesity-related disorders. Myofibroblasts are specialized contractile cells involved in tissue repair and wound healing. They possess characteristics of both fibroblasts and smooth muscle cells, enabling them to generate and transmit contractile forces. Myofibroblasts play a significant role in the contraction and remodeling of scar tissue during the healing process. They are particularly abundant in granulation tissue, where they help close wounds and promote tissue regeneration. The contractile properties of myofibroblasts are attributed to the presence of stress fibers comprised of actin and myosin filaments. These cells also produce and secrete various extracellular matrix components, such as collagen and fibronectin, contributing to the structural integrity of healing tissue. Blood vessels are crucial for circulation, moving oxygen, nutrients, hormones, and immune cells throughout the body. They include arteries, veins, and capillaries. Histologically, they have 3 layers: endothelium, smooth muscle, and connective tissue. Their structure and function vary to meet physiological needs. The synovial membrane, found in synovial joints, secretes synovial fluid that lubricates the joint and supplies nutrients to the articular cartilage. It consists of 2 layers: the synovial lining, which produces the fluid, and the subintima, which contains blood vessels and fibroblast-like cells. To summarize, histology provides a detailed understanding of tissue structures and functions. This knowledge is essential for medical professionals in diagnosing and treating diseases. Studying the microscopic level of tissues enhances our appreciation of the human body and contributes to medical advancements. Thank you for watching and see you in the next lecture.